Good afternoon. The Premier and I are here today to provide an update on the cluster of new cases of COVID-19 in Prince Edward Island. Tomorrow, we'll return to my regular weekly briefing on more broad and general issues related to COVID-19. In the last 3 days, we have reported 5 new cases, bringing our total number of cases to 32. Today, I'm pleased to report no new additional cases. And to recap these new 5 cases over the weekend, all 5 cases are islanders and are not related to seasonal residents or the Atlantic bubble. All 5 cases are at home and doing well. One is an essential worker who traveled outside Atlantic Canada and has been self-isolating. The remaining 4 cases are all people in their 20s. These 4 cases appear to be connected, meaning we can identify a probable source of infection for each case in this cluster. As I reported at weekend briefings, one of these cases, a young man, traveled to Nova Scotia and spent time with another man in his 20s who had recently arrived from the United States. We have been working closely with the Chief Public Health Office in Nova Scotia, and this is another good example of how close the relationship between our Atlantic provinces is. Yesterday, it was reported publicly the male who traveled from the United States to Halifax has tested positive for COVID-19. And there are media reports that this man was traveling to P.E.I. I can confirm that he did not have the necessary pre-approval to travel to Prince Edward Island, and he did not come to P.E.I. As an update on Whisperwood Villa, all the resident and staff testing to date that has been completed has been negative. All but one resident has been tested, and it's not possible to test this individual due to an existing medical condition. The facility has arranged for this resident to be on additional precautions for 14 days. A small number of staff still need to be tested, and we are working with Whisperwood Villa to arrange for this testing to occur. And all staff and residents will be retested beginning July the 8th. Visitors to the home on June 30th are being contacted to arrange for testing, and we've had outstanding cooperation from Whisperwood Villa. Together with the facility, all steps are being taken to protect the residents and staff of the facility, and their safety remains our top priority. Over the past 24 hours, we have followed up on the 10 close contacts identified of the 2 new cases that were reported yesterday, and all of these contacts have tested negative. As I mentioned earlier, no new cases are being reported today. All close contacts of our 5 active cases that have been recently confirmed will be in self-isolation for 14 days and will be followed up daily by public health. All our contact tracing was done for each of the cases within a 24-hour period. And we've said different times in preparation that quick and comprehensive contact tracing is really key to containing the spread of COVID-19. And a special thank you to Public Health Nursing for helping over the weekend. As I noted yesterday, we can all be proud of how our entire system has responded to this new cluster of COVID-19 cases. Given we can identify a probable source of infection for each of the active cases, there is no clear evidence of community spread of COVID-19 at this time in the province. There would, of course, be greater concern if cases were being diagnosed without a history of travel or a direct connection to someone who had traveled or tested positive for COVID-19. Throughout this pandemic, Islanders have been able to travel off-island for both essential and non-essential reasons. But travel was and continues to be subject to the restrictions of the jurisdiction people are traveling to. For instance, prior to July 3rd, Islanders were required to self-isolate for 2 weeks upon returning to the province from other Atlantic provinces. And the Atlantic travel bubble eases the requirement to self-isolate for residents of Atlantic Canada. It is important to note that although the bubble allows for easier travel within Atlantic Canada, we still have border screening and travel pre-approval measures in place. Border screening has played an integral role in how we as a province have managed this pandemic. I anticipate some type of border screening to remain in place in P.E.I. for the foreseeable future. COVID-19 has not gone away. Recently, the World Health Organization noted the virus still has a lot of room to move. This new cluster of cases is a strong reminder that we are still susceptible to COVID-19 and that we cannot become complacent. After 67 days without a case, we knew a resurgence of COVID-19 was possible at any time. We all hoped, I hoped, you hoped, the virus would not come back, and many islanders were beginning to feel that life was getting back to normal. But I do know that the measures we have put in place over the last number of months have made a difference in decreasing the risk of COVID-19 and the virus spreading in Prince Edward Island, and they will continue to do so. We have to learn to live with this virus, but we cannot let our guard down. Each of us is responsible for taking the necessary steps to protect ourselves and protect others. The decisions that we make as individuals to protect ourselves impacts our own personal health and that of our families, friends, and our community. So I urge all islanders to follow the public health measures and stick to the basics that we have been reiterating for the past number of months. Please keep your circle of contacts small, practice good hygiene, do not go to work if you are feeling unwell, and call 811 if you have symptoms of COVID-19. We know the more closely you interact with others and the longer that interaction, the higher the risk of COVID-19 spread. We know that some individuals who have COVID-19 do not have any symptoms. This is why islanders are asked to keep that physical distance when engaging in public activities. This is also why restaurants and organizations, for instance, are required to record the names and contact information of individuals so that we can help in the contact tracing if a case is identified. It's not possible to have zero risk of infection. We must understand and assess those potential risks and take reasonable steps to reduce those risks. For example, it is recommended that people wear a non-medical mask when they are in situations where it's not possible to maintain a physical distance of 6 feet. And I know there's been ongoing discussion regarding masks and particularly use of non-medical masks. I'll be making an updated statement around the guidance of non-medical masks tomorrow. I was stopped on the way into the building this morning, and a gentleman said to me, "I am sorry we had cases on the weekend, but I know it was not unexpected. But there is no place I would rather be and rather live than here in Prince Edward Island." And I agree. So let's continue to look after each other. Let us be patient and let us be kind. Thank you. And I think I'll open it up right away for questions for the Premier or myself.
Brian Higgins, CBC.
Yeah, good afternoon, Dr. Morrison, Premier King. Dr. Morrison, you mentioned that all contacts who have tested negative who came in contact with the 2 new cases Sunday, but I'm wondering if you could just tell us more about the whole overall process of contact tracing. For instance, how many contact tracing tests have been done as a result of this new outbreak? Did patient 0 visit other public places? And do you think there may be other contacts out there that you have not been able to conduct testing on?
So, hi, good afternoon, Brian. So the close contact tracing, and these are people who you have spent time with or any period of time with, and certainly face-to-face contact with. we determine this by some really good questioning by public health nursing, and I start to get some of that information even when I speak to the cases myself. And they, for instance, might say who they live with, because it's very difficult to self-isolate from the people you live with. And so those would be those people would be identified as close contacts and would be tested. Also, if they had lunch with someone or interacted with them face to face and didn't have a mask on, they would be identified. So, and we asked them to think about everyone they would have had contact with, not only when they started having symptoms, but actually going back 48 hours prior to their symptom onset. And that is really using an abundance of precaution as well. And so in the situation with the 2 new cases yesterday, they had very limited number of contacts, but they did have a total of 10, and all of them were able to be contacted yesterday, and they had their tests done and they came back negative. So we're very pleased about that, and of course we are all feeling reassured, and that's a positive thing, I think, today.
As a follow-up, a lot of people are curious about the context by which the man from his 20s traveled to Nova Scotia and came back, and also the context in which a man who had been in the United States was in Canada. What can you tell us about why that travel was taking place?
Well, I can't speak in too much detail about the gentleman who arrived in Nova Scotia, and it certainly, from my understanding, was in the United States. So I do not know too much of the details about that. And I think there will be a follow-up with probably the Public Health Agency of Canada, Canadian Border Services Agency through Nova Scotia, because they would have identified that as him as a case. I do understand that he was trying to come to Prince Edward Island, but he did not have the pre-approval travel in place to do so. And in terms of the person from here who traveled over to Nova Scotia, they did have contact, but then the resident from Prince Edward Island, of course, was able to return to Prince Edward Island, showing proof at the bridge that he is an island resident, and then. But that's where it was able to be traced back to, and it's interesting to note that the case here in Prince Edward Island, and I believe the case in Nova Scotia, had no symptoms, or certainly very mild symptoms.
And why did the person here fail to self-isolate properly?
Well, I actually think he made every attempt to self-isolate, and I think that's important to know. And it is a challenge to sometimes, as I indicate, self-isolate in certain living situations. And we use this as an opportunity, and I think it's a really good opportunity to remind people what self-isolation really is. And it means trying to live in a separate part of the house, not sharing a bathroom, not sharing utensils. We have had some really good examples of people living in either separate parts of the house, or in a basement, or a separate bathroom, or with a separate bathroom and bedroom, and having meals dropped off, and not using any shared utensils. So that's more challenging if you have multiple people in a small environment. So we appreciate that can be difficult.
Thank you. Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Morrison. J'avais juste une question en français sur le jeune homme qui a la vingtaine, qui est revenu de Nouvelle-Écosse. Il n'a pas de symptômes, c'est bien ça?
Je ne pense pas. C'est vraiment les détails de ce cas sont vraiment en Nouvelle-Écosse, mais ce que je comprends à ce moment est qu'il n'a pas beaucoup de symptômes. On n'en a pas.
D'accord. Et est-ce qu'il y a des nouvelles données sur la transmission asymptomatique de la COVID-19? Est-ce qu'on en sait un peu plus si les personnes sans symptômes, elles peuvent transmettre la maladie comme les personnes avec des symptômes?
Ça dépend quelle étude, mais Laurence, mais c'est des fois c'est 20 à 25% qui n'ont pas des symptômes. Et puis on voit une variance du pourcentage, mais c'est à peu près 20-25% des personnes n'ont pas des symptômes, mais peuvent transmettre le virus.
Merci.
Merci.
Allison Jenkins, The Guardian.
Yes, good afternoon. I'm wondering if there are any consequences coming for either of these people. I know you can't speak too much to Nova Scotia, but was the person on P.E.I. doing everything correctly as best they could, or are there charges coming?
Well, Allison, I think the focus has been on the identification of cases, the follow-up of contacts and the testing and making sure everyone's in self-isolation. So certainly that has been the focus. And my understanding is that they have done certainly self-isolated to the best of their ability.
Oh, okay, perfect. And my next question is just about the bubble and the number of people who've arrived so far. It's not really related to the new cases, but do you have any numbers on how many people have come to P.E.I. with the Atlantic bubble?
I'm actually getting updated numbers twice a day. I did not bring them here, but I will have them available for the briefing tomorrow. The number was the highest on Friday, and it has dropped significantly over the weekend, but I will have those numbers in front of me tomorrow.
Okay, thank you very much.
Okay.
Travis Kingdon, CBC.
Hi, Dr. Morrison. Curious with the retesting being done at Whisperwood Villa, if there's any chance that the initial negative tests are false negatives and that we could potentially see a positive case there in the coming days.
So the testing of the residents will be done at Whisperwood Villa starting later this week, and a lot of the staff will also be done at the testing clinic. We have a lot of confidence in our tests, but we actually increase the sensitivity of the tests by doing 2 tests so many days apart. So it's and that's why we want to be that much more certain that we actually those tests are accurate. So that's why none of the restrictions in terms of the visitors and no communal dining, for instance, enhanced precautions at Whisperwood Villa, they will not be lifted until that second test. So I remain really hopeful, as I know all of us are, that all those second tests will also be negative.
And then I'm curious, with this case in Whisperwood, does this change any of your recommendations for other long-term care facilities here on the island?
I actually think it's been a really good example of how the system had good guidelines in place, and we have restrictions on long-term care staff working in multiple long-term care facilities, and I think I mentioned that yesterday, that they're not allowed to work in multiple long-term care facilities, so I think that's a good thing. There's good personal protective equipment being used in the facilities. There's and this case identified really quickly she wasn't feeling well, and they're keeping track of the visitors. So a lot of the guidance in various areas has been put in place, and I think Hopefully all the tests will come back later this week of being negative, and it will be a good example of why we have all these restrictions in place and have been working through the system, both private and public long-term care in that regard.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Ma question pour vous en français, Dr. Morrison. Qu'est-ce que vous pouvez nous dire sur les circonstances de la rencontre entre l'insulaire qui a contracté la maladie en Nouvelle-Écosse et cet Américain qui tentait de venir ici à l'île? Dans quelles circonstances ces personnes-là se sont rencontrées? Sous quel prétexte l'insulaire qui voyageait en Nouvelle-Écosse était hors province au moment où ça s'est passé?
Je ne peux pas raconter tous les détails, mais ils connaissaient les deux et puis ils étaient dans la même voiture et puis ils restaient au même endroit. Alors, c'est sûrement ça que je peux te dire.
L'insulaire, est-ce qu'il était en déplacement pour un voyage essentiel en Nouvelle-Écosse?
Il était là pour rencontrer cette personne et parce qu'il le connaît.
Et si je peux me permettre, Dr. Morrison, pour ce qui est de l'isolement de cette personne, de cet insulaire, vous dites qu'il a tenté par tous les moyens de s'isoler, mais que ça n'a pas fonctionné, c'est ça?
Je pense qu'il s'est fonctionné aussi bien que possible pour lui. Et puis, j'ai mentionné en anglais que c'est des fois difficile de auto-isoler si vous n'habitez pas dans un endroit où il y a des chambres qui sont séparées, des salles de bain qui sont séparées. Alors, je ne sais pas pour certain qu'il comprenait vraiment qu'est-ce que auto-isoler voulait dire, mais il quand même a fait son mieux. C'est bon pour tout le monde de comprendre qu'est-ce que ça veut dire auto-isoler et que c'est tellement important parce que il y a souvent les personnes n'ont pas les symptômes.
Merci. Stu Nepe, The Guardian.
Hi, good afternoon. A question for Dr. Morrison. Just sort of zeroing in on, I guess, the U.S. resident. I mean, for starters, I guess, was this person a U.S. resident? It's been sort of reported that he visited the U.S. and that he's been a U.S. resident, so I just want to kind of confirm that detail. And I guess, I mean, in terms of passing through Nova Scotia to come to P.E.I., is there anything that you can sort of indicate as to why? I mean, was this person sort of residing on P.E.I. at one point?
Hi, Stu. So I am not certain if he was a resident or had been living in the United States, but I am certainly, my understanding is that he was in the United States. And so I can't speak to what happened at the border, the U.S.-Canada border. When he entered the country. As far as I know, he is not and has not been a resident of Prince Edward Island, but we will certainly likely learn more. And but I have not spoken to that particular case in Nova Scotia, obviously, but I imagine we will be able to get further information from Nova Scotia even later today.
Okay. I'm curious, I guess, about the monitoring for the individual who did come back. So, I mean, you mentioned that he did try to self-isolate as best he could, and sort of close quarters or whatnot. But I mean, there was a sort of separate company that was contracted to do check-ins, like phone checks, vision research. So I'm wondering if this individual sort of had the sort of phone follow-up, over the course of the week of 29th to the 3rd when he was tested.
Yes, he did have a follow-up through our Operation Isolation.
Okay. Thank you very much.
Karine Fleury, La Voix acadienne.
Oui, bonjour, j'ai une question en français pour le docteur Morrison. Si vous pouvez répéter où en est la recherche des contacts, en fait, et des tests qui ont été faits en lien avec les nouveaux cas.
Bonjour, on vient de faire les contacts qui sont proches des cas d'hier. On avait 10 et puis ils ont tous eu un test négatif. Alors, c'est une bonne nouvelle pour nous et on n'a pas de nouveaux cas aujourd'hui.
Parfait.
Rachel Collier, Eastern Graphic.
Hi, I have a question for the Premier today. And I guess you've considered creating designated rest stops for those traveling from out of province to Magdalene Islands before. It's been a bit of a topic of conversation. And I'm wondering if designated rest stops for people traveling from outside the Atlantic bubble is something that you're considering now. Would it be useful to mitigating the spread of COVID-19?
Well, thank you, Rachel, and that might be a question that I might get Dr. Morrison to assist with. I think that anyone coming into Prince Edward Island from outside of the Atlantic region would need to demonstrate that they have a 14-day isolation plan, they have a place to self-isolate for 14 days, and would be subject to our Operation Isolation. So I'm just, maybe I need a little more clarification in the question just in terms of, you know, you mean on as they're traveling to PEI? I'm sorry, but I might be a little confused by the question.
So traveling through PEI to get to the Magdalene Islands, so they'd be taking the ferry and Surrey.
Yeah, okay, so yeah, we've been trying to work with our colleagues from the province of Quebec and the province of New Brunswick, similar to what we've been doing with other provinces as they have allowed residents to pass through their jurisdictions to allow their islanders to get home, that we have been doing the same with those in that will be traveling from Quebec to the Magdalene Islands. We have been, I know that when they enter New Brunswick, they are told that to follow the necessary public health directives, to stop, you know, essentially only when needed. It's the same when they come to Prince Edward Island, but like other provinces have done for islanders, when those who are traveling through need to stop for fuel or need to stop for food, we provide that, and we ask them just to do that as safely and as cautiously as possible, like all islanders have.
Okay, so a designated stop isn't really something that's on the agenda.
I don't believe there's been any designated spots, but we have updated the information in both English and French for the Magdalene Islands, or people who are traveling to and from the Magdalene Islands, and also they're through the Eastern Council, I may not have the right words there, but they have also provided some information with some services and numbers that people who may be traveling to Magdalene Islands can call, and to provide delivery to their vehicles, for instance, while they're waiting for the ferry. And so I think that's been that's a good for everyone. And so I think that information also has been provided and is available. So that is relatively new in the last couple of weeks.
Okay. And I guess as a second question, can those who work in long-term care homes travel within the Atlantic tourism bubble as freely as anyone else at this point, or do they have special restrictions in any way?
The public health order does not restrict the movement of long-term care workers in the Atlantic bubble, but they are certainly if they were to work in a facility in another part of Atlantic Canada, they would be subject to testing before they would return to work here. And some facilities are putting some of their own restrictions in place, and it may be a good thing for me to even go through some of the clarifications. We have some of that information on our website, and we've clarified that in some question and answer for healthcare workers, but we can certainly, I may be able to speak to that tomorrow and include other categories as well.
Good, thanks a lot.
You're welcome.
We'll now open it up to additional questions.
So Stu Neatby from The Guardian. I guess another question for Dr. Morrison. So you'd mentioned that the individual who spent time in the States had not obtained travel pre-approval. Now, does that mean that they had actually applied for travel pre-approval and had been turned down, or they had simply not applied at all and, you know?
They had not applied, and they did not have paperwork to get into this province.
Okay, so as in they arrived and were essentially turned back at some point.
Yes, that is correct.
Can you say anything about under what classification they applied under?
Well, they didn't apply. They didn't apply.
Right.
And so, yeah.
So just for further clarification, I mean, with our screening process, we have turned dozens of individuals around in the last number of weeks because they didn't have they didn't make application or didn't have the proof of residence or all of the documentation that we require.
Okay.
Any additional questions from the media?
François Pierre Dufault, Radio-Canada. So just to make it clear, this individual who was in the United States actually came as far as the Confederation Bridge to be turned back to Nova Scotia. Is that my understanding of what it was?
Yep.
Yes, that is our understanding as well.
Thanks.
Okay. All right. Well, thank you, everybody. Have a good day.